So you can see already, even with the splint on, you can see the improvement that he's got.
ఓకే.
అయిన తర్వాత హాస్పిటల్కి వచ్చిన తర్వాత నాకు సర్జరీ జరిగింది. 100% రిజల్ట్ వచ్చింది. సూపర్.
Come out. There was like a major reconstruction for him also. This is day 7. We're going to take off his splints tomorrow. Yeah, just to show them what was done. Yeah. He's getting pip test now, isn't it? So we did a septal reconstruction along with rhinoplasty and a septoplasty. We're just trying to locate his pictures before. So I've taken a rib, we've done augmentation from the radix. I'm not going to be taking the splint off today because he's going to be here with us till Sunday morning. And so tomorrow evening, either me or Dr. Priya will be removing the splint. Okay, we're going to show you just to know how severe his nose was. You can see already, even with the splint on, you can see the improvement that he's got. Yeah, दर्द है थोड़ा सा भी कि ज़्यादा दर्द नहीं है. So just asking if he's having pain from the rib harvested side. It's a totally collapsed nose, and you can see the real thing tomorrow when the splint is going to be removed. But that's the different views that he has. Side views. Okay. दर्द कुछ ज़्यादा नहीं है ना अभी आपको दर्द है कि नहीं तमिल दाना வலி இருக்குதா எங்கேயாவது வலி இல்லை ஒரு இடத்துலையும் நல்லா இருக்குது so he says no pain and he is very happy நாளைக்கு எடுத்துடலாம் டாக்டர் எடுத்து விட்டுருவாங்க எல்லாத்தையும் சரியா bye thank you
Hello everyone, greetings from Richardsons Hospital. So we are following up a patient for rhinoplasty. He's been operated by Dr. Richardson about 8 days back. We will discuss this case with you further right now, which is post-op. But we have had a detailed summary of his before the surgery. That's because he came to us around 8 to 9 days back. We also followed him yesterday. Dr. Richardson spoke and explained all of you about what was his situation before and what has been done. It was an extremely challenging case for him. We'll go on to remove the splint for him now. Little up. This won't pain, don't worry. Okay. Just a minute. It's the sticker marks which are there. Okay. So we'll go on to show his before picture. This is his pre-operative picture. His was a very challenging case. Dr. Richardson briefed you about the pre-operative state as well. So Dr. Richardson has explained about the pre-operative condition. One look at his nose and we see it's almost into 2 parts. It's as if there's a flat dorsum, there's a break in between, a major break, and then it's continuing as the other part. This state happened because he had a rhinoplasty done previously, probably a septorhinoplasty which was done about 13 years back. And post which he also met with an accident. So in his own words, The splint was removed for him. Probably an osteotomy was done. The nasal splint was removed, and immediately he bumped his nose by a bike accident. Post which, this is the deformity that is there. He has not sought any treatment post that. We'll go on to show other pictures, and this is how the rhinoplasty done by Dr. Richardson looks currently. The dorsum has become straight. The nose, which was literally in two parts, is no longer in two pieces. It's become one uniform straight dorsum. You can turn on one side, little bit towards your left, little bit more, and we can go on to show other pictures. The left side, yes. So the left side is how it looked before. There was almost like a dorsum with a severe break, and then it led to a tip. There was no support, there was a break at this junction. Osteotomy has been done. His rib harvest was needed for a dorsal augmentation. The aesthetic lines are seen now. Tip work has been done. In fact, his alar base has also been done for a proper symmetry. We'll go on to show different views for him. Another view. Yeah, turn to your right side. We can see the right side. In fact, we'll give the patient a mirror. You can hold this and you can have a look. You can have a look as to how it looks now, and also see the image. Yes, turn towards your right. See how your nose was before. It was almost in two pieces, and that was because you had a surgery done and immediately met with an accident. So the nose must be in a fluid state at that point in time, and it again got fractured and deformed. It was almost a reconstructive rhinoplasty for him, and this is how your nose have become almost in two pieces. We'll go on to show other views. Yes. Yes, you can see this. Just turn little bit towards your left, not so much, little bit. Now you see in the mirror your previous look and the look now. So there was the dorsum which was all bony. His septum was very difficult to work upon. Why? Because already a surgery was done on him. Graft has been taken, this depression has been bridged. Alar work has been done. We'll also see the basal view. Look a little up. Yes, and we'll see the picture, the basal view for him as well. This is how his nose looked from the basal view. Yes, you can also see. So the nose was almost in two components. There was a bend, which we can see it's almost like a hump and a depression, and the alar flare was increased in his case. That has also been reduced. So it's been literally a reconstructive rhinoplasty by Dr. Sunil Richardson, and the results are for all of you to see. He has been updating about this patient since day one. We almost gave an introduction of sort as to what happened to the patient on the day he came to the hospital, followed it in the OT, prior to the operation theatre, also yesterday, and then today finally when he's leaving. So we've been checking on him such that an uneventful recovery happens. It's been achieved so far, and the results are for everyone to see. You can also see, you can see the picture here, you can see it here. So the nose has become straight, it's become narrow, it's in one line. These are the osteotomy stitches that will be removed. The bend is no longer exists, the alar width has been reduced, tip work. Definitely one of the most challenging cases done by Dr. Richardson of late, because it was almost like a reconstructive rhinoplasty. The previous work, amount of work that was done before, also the trauma that he had suffered years back. We'll show another view. Yeah, another view, sister. Yeah, almost this picture is quite fine. We zoom a little bit. Yes, we see this was how exactly his nose was, and this is how his nose looks right now. It's straight. The bent has almost disappeared. It's like the reconstruction was worth it. All of you can appreciate the results. Yes? We'll clean everything up and remove the stitches for you. Okay? It's good.
100%.
Even if it's bad, you can tell us. You wanted a change. We have tried delivering that. You already had one rhinoplasty, right? And post that you met with an accident. So this time you have to be double careful, because it was a very major surgery for you. So no roaming on bike, no, not exposing yourself to any untoward event, no contact sports, no blowing the nose, no steam inhalation. We'll give you the list of medications as well. Every order has to be followed. Okay. You can have a close-up look at the before and after, the frontal view. Okay, just look a little straight. It's almost like a new nose.
100% result.
Okay. You're happy, content, that's important.
Happy, ma'am.
Yeah. Now any pain exists along the rib side?
No pain, ma'am.
No pain. Nose, any area? Little bit of swelling was there for you after the surgery. It has come down. Still there is swelling. It will become better because I can see there is swelling everywhere. Yeah. Would you like to share something about your experience coming here to our subscribers, because the change has been tremendous for you, to say the least? Probably he's shy and also at loss of words. That's okay. His expression says it all. So yes, it's almost a proper reconstructive rhinoplasty. Yeah. Thank you.
2018లో నేను బండి నుంచి కింద పడడం జరిగింది. నాది ముక్కు కొంచెం బెండ్ అయింది. నేను ఏ హాస్పిటల్కి వెళ్ళినా ఇది కాదని చెప్పిర్రు. తర్వాత నేను యూట్యూబ్లో వీడియో సునీల్ రిచర్డ్సన్స్ హాస్పిటల్ వీడియో చూసిన తర్వాత ఇక్కడ కన్సల్టెన్సీ అయిన తర్వాత హాస్పిటల్కి వచ్చిన తర్వాత నాకు సర్జరీ జరిగింది. 100% రిజల్ట్ వచ్చింది. సూపర్.